Thank you. I like the beginning of Down There Care. What if you can't have sex? Not because you don't want to, but because it hurts. Sexuality is one of the greatest gifts a couple shares. It deepens intimacy and trust. It helps you feel whole, loved, and satisfied. But what if you can't? In Hollywood, you see couples locking eyes, clothes falling off. Next thing you know, they're having simultaneous orgasm. Or you're assuming your friends are having fireworks sex. And then when your partner pulls you close and tries to touch and kiss you, you pull away because you know it's going to end in pain and tears again. I'm a physical therapist, and you're probably wondering why I'm talking about sex. When I'm at a cocktail party and people find out I'm a PT, they want to tell me about their plantar fasciitis or their shoulder. But that's not what I do. I treat this part of the body. I'm a pelvic health physical therapist. I treat the private parts, the things people don't talk about. I treat peeing and pooping, pregnancy and postpartum, pain and prolapse, that's the organs falling out, and sexual dysfunction in both men and women. When I'm at that party or even here now, some of you are probably pretty curious about what I'm going to talk about. And others probably are squirming and want to walk away. My dad was curious early in my career, and he asked, just wait, do you really go in vaginas? And I said, Dad, I've been in more vaginas this week than you've been in your entire life. I'm glad the joke went over. I go in rectums too. I spared him that at the time. Oh, sorry. But really, it's serious. This is serious. There is so much shame and taboo with these body parts. Even the nerve that innervates this body part is called the pudendal nerve. The pudendal, and the Latin origin of that word pudenda is to be ashamed or shameful parts. So this part of our body has been baked into shame and taboo for centuries. And that traps people in a way that they're too embarrassed to talk about the things that are affecting them that they could get help on. Like they could have a bowel movement once a week, or every time they jump, they pee in their pants. Or the poor girl who can't find a place to put a tampon, so she has to quit swim team. Or the guy, when he gets an erection, he has burning to the tip of the penis. Or you haven't had sex in 2 or 3 years because you dread it. That is why I like talking about it today and at that cocktail party, because I feel like it needs to come out of the closet and be talked about and let people get the help they need. So let me tell you about a couple of my patients, and I have dozens of stories, but I'm limiting to just a couple. Emily, and of course the names are changed. Emily, she's been married 18 years. She's 38 years old, and she has not been able to tolerate penetration, not once. No tampon, no gynecological exam, no intercourse. That means no children. Her family never understood why she never had kids. She felt like a failure of a wife. They did have outer course, which is still sexual, and they maintained some intimacy that way, but it is not what they hoped for. She saw dozens of practitioners, cried in their offices. That is not how it's supposed to be. Or Keely. Keely's a 26-year-old lawyer, high-stress job. And she tells me she's able to have sex, but on further questioning, it takes about 5 minutes for her partner to work his way in while she's breathing, while she's relaxing, as they're wiggling around trying to get there. She tries not to wince. You know, that does sort of ruin the moment. And she says to me, isn't it supposed to hurt? No, it's not supposed to hurt. It's a big thing in a small space, but it's not supposed to hurt. She goes back and talks to her coworkers. Same story, 3 out of 4 of them. And then there's Josh. Turns out men are not quite as hesitant. Some men are, but some men are not as hesitant about talking about their body parts. Josh comes in the first day and tells me when he has an erection and when he has an orgasm, he gets fire in his penis. Oops. That is not how it's supposed to be. And it lasts hours to days. Who would want to live like that? These things are common. And you're probably thinking they're not common, but they are so common. Up to 50% of women have pain with intercourse at some point in their life. Some of it is postpartum, some of it's postmenopause, some of it is their entire sexual lives. What happens, well, if it's vaginal atrophy, which is the thinning of the skin with menopause, people are probably familiar with that, estrogen cream can help that a lot. But when it's the muscles that wrap around the entrance of the vagina, and most people don't know they have muscles around the entrance, those muscles spasm uncontrollably. And when they try to have penetration, the ones that can't have penetration, they all describe it exactly the same, like ripping and tearing. That doesn't do much for your libido. And the other ones aren't able to have penetration at all, 100% like they're hitting a brick wall. This is called vaginismus, and it affects up to 17% of women in our culture. And in more conservative cultures, it can be as high as 60%. For those born male, sexual activity affects up to 9% of men. And for men with chronic pelvic pain, men that already have problems in this part of the body, it's 1 in 3. And really, how are they surveying these people? Have you ever had a healthcare practitioner ever ask you about your sexual life? Are you having sex? Does it hurt? Do you have orgasm? Have you ever had an orgasm? How's your erection? And actually, when it comes to erection, there's a little more discussion about erection because of that little blue pill, Viagra, that you're probably familiar with. That fits so neatly into the medical model, one problem, one solution. But these folks, they fall into a diagnostic dead zone. There is no test, no MRI, no blood work that can be done. They see 10 or 20 practitioners while they're searching for this. I could be number 13 or 11. The men often get misdiagnosed with inflammation of their prostates, given antibiotics that don't help. The women, when they get the courage to finally talk to their healthcare practitioners about painful penetration, they're told they're normal. You just need to use more lube. Have a glass of wine. Just relax. If that little inebriation would have helped them, I would be out of a job. But it doesn't help. These women and men suffer in silence. They feel alone and isolated and betrayed by their bodies. So we probably need to talk a little bit about the anatomy. So first of all, you're all sitting on your pelvic floors. Everybody here has one. And in that picture, you're looking down into the pelvis, and you can see all those muscles. They attach to the pubic bone, and to the tailbone, and to the pelvis. There are also back muscles and hip muscles that are involved, which makes it so much more complex to really treat. But these are muscles just like muscles in the rest of your body, like a bicep. It should get hard when you contract it, and it should soften when you relax. And if you get sore, when you relax, all that blood flows in there and rinses out the soreness. Those are happy muscles. The pelvic floor is actually 18 muscles, and they have a couple functions. The number one function is for them to hold our organs in. Organs actually fall out. That's called prolapse. But it holds in the colon, the rectum, the uterus, the bladder, the prostate, in a nice sling, and it needs to be strong for that. The other function is to allow things in, like a tampon or a penis. The next function is to allow things to exit, the big one being a baby coming out of there. And the vagina expands almost 4 times that size to birth a baby, and somehow goes back to something close to normal. But on a day-to-day basis, it lets out pee and poop and gas. And hopefully, at socially appropriate times, nobody likes wet pants or farting during a job interview. And it's involved in sexual function. It helps with penile erections, female arousal, pain-free penetration, and those muscles are involved in having good orgasm. So I like to let my patients know before that first visit that lube and glove will be involved. It is so helpful. We get so much information quickly when we're able to feel what's going on with the muscles. And it's all done, of course, with their permission and with minimal dysfunction. So what happens when we feel these muscles? In the female, or those born female, there's muscles that wrap around the urethra, the vagina, and the anus. And they're about this big. The space around the vagina, it should be about this size. And these muscles should be relaxed and not tender. And if you notice, it's about the circumference of a penis. It's perfectly engineered for intercourse. But when these muscles are tight, nothing can go in. And that's what's happening. On those born male, the muscles go into the base of the penis that helps with erection and ejaculation and how the testicles hang. And what they should look like when they're relaxed is that their parts should dangle. It should be like a guy getting out of a hot shower. The penis and testicles should dangle. When they're tight, that rides up. And when they have sexual activity, it stretches and they work and they have sharp pains. So we're going to do a little demonstration. You all can feel this right now. You all have pelvic floors. We're going to do both a contraction and a relaxation. These folks all need to learn how to relax, and we're going to do that first, and we'll do the strengthening after. But it's important that you know how muscles work to know what a good muscle is and what a relaxed muscle is. That's how muscles stay healthy. So what you're going to first do is separate your teeth and undo your jaw. People who clench here tend to clench there. I see some of you unclenching. Next, you're going to undo your abdominal wall. When you tighten here, you tighten there too. And somehow in our culture, we have been taught that we're supposed to keep our core tight all the time by our trainers, by our mothers, by our culture. So let go there. A healthy muscle needs to let go and get blood flow. So let go of your abs. And then you're going to let go of your bottom, the place that you're sitting on. You want to let go and let that drop like you're going to pee. Some of you hopefully felt nothing because you're good at relaxing. And others, you felt your jaw, your abs, and your pelvic floor relax, and your pelvic floor overachievers, and those muscles need a break. So try to learn to let them go. Next, on the flip side, we're going to do strengthening. These are familiarly called Kegels, and probably most of you, hopefully in the room, know what a Kegel is. I'm sure the women do. Kegel was developed by a gynecologist in 1949, Arnold Kegel, and he was doing this to help his postpartum women who were leaking urine and their organs were falling out. So he thought, good idea, we should strengthen that. So to strengthen that, we're all going to try to do it together, so don't start just yet. We're going to try and do it without your glutes and try and hold it for 10 real seconds. So those with vulvas, that's female genitalia, you're going to pull up and in, and those with penises and scrotum, you're going to pull up and in. So pull up and in, and we're going to count 1, 2, 3, keep pulling, 4, 5, 6, 7, keep pulling, 8, 9, 10, and now let go. Some of you probably did that great because you're really strong, you're pelvic floor powerhouses. Others probably see how hard that is to do, and that makes sense why you're leaking when you're doing a jumping jack. So you can try doing that with a jumping jack at home. I keep touching that. So why do these people keep these muscles tight all the time? There's the connection between the brain and the body, and you're familiar with that. When you are nervous before a big test or you're getting on an airplane, you get butterflies on your stomach or you have to pee, and that's that connection. If you had a busy week, all your muscles tighten up. So anything that's happened in your past can make your nervous system ramp up and tighten your muscles. And people do this as a habit, just keeping their muscles tight all the time. And it could be a number of reasons. One, it could be trauma in your past, where your house burned down, an automobile accident, or even abuse. And your central nervous system ramps up your muscles, and your muscles try to protect you. Or it could be negative community and cultural messages about sexuality. Sex is dirty, taboo, off limits, don't touch yourself. And those muscles ramp up to guard. Or it can be, probably some of you in this room, type A driven individuals, straight A students, PhD candidates, doctors, lawyers, bankers, CrossFitters, elite athletes. Your muscles are excellent at contracting and terrible at letting go. So how do we treat this? It is not doing Kegels. A lot of times people think that pelvic floor physical therapy is just Kegels. It is much more. For these folks, it's all about relaxation. Stretches for the whole body, manual therapies that are like myofascial release or massage on the outside and on the inside, breathing techniques to calm down the central nervous system, lots and lots of education about where the muscles are, how the muscles work, how sexuality works, how arousal works, and lots of education on doing less. This is not well received by my hyper-driven type A individuals. They need to exercise less, maybe not work that 80-hour work week, do less activity. They're not always happy when we suggest it, but once they start seeing the results, they're more convinced. So my patients, back to my patients. Emily had pain-free intercourse for the first time after 18 years of marriage. And she sent me a picture of her beautiful baby girl. I know, it's the sweetest. And there's so many women out there like this. And a shout out to her sweet husband who supported her along the way. Keely, she's able to have intercourse as fast, as slow as she wants without wincing. And turns out her libido has improved, because do you think maybe pain was interfering with her libido? And she shared this with her colleagues, and hopefully it'll help them as well. And Josh, with that burning penis, that has gone away, as long as he keeps up with his yoga and his stretches. Painful intercourse is so common and so treatable. With education and good treatments and understanding sexuality and muscles and reducing the shame and taboo, these things can be fixed. But with this and every area of healthcare, it is so important that you advocate for yourself, that you do your research, that you reach out to your healthcare community, that you find the practitioners that can help you, communicate with your partner, and get the help that you need. But before I end, one final comment about that couple having simultaneous orgasm. That is 100% fiction. Only 10 or 20% of women ever have an orgasm with penetration. The rest, lots of other ways, and they are perfectly normal. Thank you.